States across the U.S. are taking steps to ensure the most vulnerable in this country are the first in line to get the vaccine. But for many, it feels harder than ever. In the South, 4 states in particular have fallen behind. That's according to the CDC. Alabama, Georgia, Mississippi, and South Carolina have each managed to immunize less than 2% of its population. Earlier this week, New York City Mayor Bill de Blasio announced the city would run out of its vaccine supply next week if it continues vaccinations at its current pace. So for more on this, let us bring in Dr. Bob Lahita. He's a professor of medicine at the New York Medical College and the chairman of medicine at St. Joseph University Hospital. Thank you so much for joining us again, Dr. Lahita. You got your second dose of the coronavirus vaccine. So how are you feeling? Any side effects? What's going on?
No side effects for the second shot. There I am getting the shot. And I have to say that I was prepared for the worst. But I didn't take any acetaminophen or any kind of anti-inflammatory before the injection. And I wanted to see what would happen. Everybody was talking about fevers and aches and pains, but I didn't have any of that. And most of my colleagues didn't either. The first shot, we had a little bit of achy, painy stuff, but basically this was a very, very easy vaccine to get.
Dr. Bob, Norway says COVID-19 vaccines may be too risky for the very old and the terminally ill after officials there reported 23 people died in the country a short time after they received their first dose. Of those deaths, 13 so far have shown common side effects, which may have contributed to severe reactions in the elderly. What more can you tell us about that?
Well, I think if you're really gravidly ill and you're in, say, hospice, or you're in a palliative care situation where you're very, very frail and fragile, the side effects could be somewhat devastating to you. But that is very, very rare. I have seen 90-year-olds and 80-year-olds here who have been in nursing homes and have been immunized with no problem whatsoever. They will basically have the side effects that most of us would have. But like everything else with this virus and this vaccine, there are exceptions to the rule. So it is possible, and I know in Norway, this is what they're saying, that they will not immunize people who are frail and have many comorbidities. And that's probably judicious. So those people should stay isolated, and wear a mask and keep socially distanced. Vlad?
So, the UK was able to detect their sort of new variant of the coronavirus pretty early, and it was partially due to the amount of viral genetic sequencing that the UK performs. So according to an analysis of data from the Global Initiative on Sharing All Influenza Data, long title, here in the U.S., the median number of days from the time a sample is collected from a patient's nose until the time its genetic sequence is actually posted to a database. So they get the sample, they work it out, they post it so others within the medical community can see it and sort of crunch those numbers. It's 85 days. That's an awful long time, isn't it, Doctor?
Yeah, it is indeed. And this is a complex issue, Anne-Marie, and I'm just going to try to simplify it. And I think I can do that. First of all, we have an online database for nucleic acid. Remember, this is an RNA that's tightly packaged in the middle of the virus. Now, everybody should think of this as a paragraph of type. And every time the virus replicates in your cells and billions of copies are produced, there are typos in that paragraph. Most of the time, the typos can easily be read through. Say, we are the immune system, we're reading that paragraph, and we know that the typos are there, but we can understand the paragraph. Occasionally, something really crazy happens, and the typos really upset the whole meaning of the paragraph. That's a mutation, and that's very, very common. So if you have trillions of viruses in your body being produced, you're bound to get a certain percentage of typos inserted into this paragraph or the genome. The genome will then be upset. For the most part, that genome, that database is available to all laboratories around the country. But in most hospitals, and I say most, they do not have the capability of doing genome sequencing data on this virus. So it has to go to large laboratories or it goes to a university laboratory where there are virologists and molecular biologists that can look at this paragraph of information and see where the typos are. Now, that's what they do in England, at the UK. So the B117 mutation was detected there. And in South Africa, the N501Y, which all affect the understanding within this genomic paragraph of the spike protein. And what's the spike protein? That's where it sticks to the receptor and gets into your body. So if it's stickier and it sticks to the receptor tightly, it means that you need less virus to infect you. So consequently, in countries, say, like Ireland, where they went from 8% infectivity to over 50% with variants, that happened very, very quickly because the virus was more infective. It did not make the disease worse, but it was more infective. So less virus, more infectivity, meaning more mask wearing, more gloves, more washing your hands, more social distancing. I hope I was clear on that.
Yeah, crystal
you
clear.
helped a lot.
Crystal clear. Dr. Bob, yesterday, research teams at Southern Illinois University and Ohio State University announced they had found a new variant of the coronavirus specific to the U.S. This is a little troubling because I know that so far medical professionals and doctors are saying that it's not as lethal, it's not any more lethal than the current strain that is infecting us here in the U.S., but the fact that it spreads so quickly is troubling because it could mean that if it really plants its feet here, it could overwhelm hospitals.
That's right. And I think, Vlad, you hit the nail on the head. You know, the virus is not going to make the disease worse. But if it gets into more people, because people aren't wearing masks and doing social distancing, et cetera, if it gets into more people, the death rate's going to rise. Why? Because the more people are infected. So consequently, if you have 50 people infected instead of 10, you're going to have 5 times the number of deaths from that population. And that's what the worry is. Again, think of this genomic paragraph with the typos in it. And if you can't read part of that paragraph, that's a new variant. And that new variant can be highly infective. And the big worry, Vlad, is that it will infect children and younger people more than, say, happened in the past, where we knew that if you were 20 years of age or younger, you didn't have a problem with this virus. But now with the stickier forms, the new mutants like the B117 or the N501Y, which we've been describing, that could change. So it means that it could be more infective. Like I've been told by the Brits, 50 to 70% more infective, which could be a major problem for us. And we could see spikes. Now, in areas where hospitals don't have a lot of staff, and there may be one hospital in rural areas for 100 miles radius, that's a problem because that hospital will rapidly fill up. There's no more intensive care space. There are no more intensivists or intensive care trained nurses in that hospital. And it's overwhelmed. And that's what we're seeing in places like Arizona, New Mexico, and in some parts of California as well. Vlad.
Really important information there, Dr. Bob. As always, we appreciate it.
Thank you.